Assalamu alaikum everyone. We are AZM Health Tech, an initiative of AZM Labs, and today we want to present a very practical idea for Bangladesh's healthcare system. Its name is Shastho Nothy. In Bangladesh, a prescription is often more than a prescription. It is the only record of the consultation. So when the paper is lost, the system does not just lose a document, it loses memory. The next doctor starts again from zero. The patient repeats the same story, the same uncertainty continues. For chronic patients, that is not a small inconvenience, that is a continuity failure. Now, the important point is this: Bangladesh is not starting from nothing. There is already digital health direction, there is already health ID thinking, there is already national intent around interoperability and digital infrastructure. So, the real question is not whether Bangladesh should move toward digital health. The real question is how to make that movement work in the busiest, hardest part of the system, outpatient care, where handwritten prescriptions still dominate real workflow. When outpatient records stay fragmented, everyone pays the price. Patients lose continuity, doctors lose context, government loses visibility. For patients, this means lost prescriptions, weak follow up, and higher risk. For doctors, it means making decisions without knowing enough about what happened before. And for the system, it means weak insight into prescription patterns, service use, and outpatient trends. So, this is not only a patient problem, it is also a clinical problem and a system problem. And this is exactly where many digital efforts become stuck. Not because digitization is a bad idea, but because the way it is implemented often does not match reality. If paper and digital systems run side by side, that creates duplicate work. If doctors must type while seeing a large amount of patients, that interrupts care. And if adoption depends on heavy retraining and behavior change, implementation slows down. Many digital systems do not fail because they lack technology, they fail because they do not fit the workflow. So we asked a different question. What if doctors did not need to change how they work at all? That is the core idea behind Shastho Nothy. The doctor writes exactly as usual, no keyboard, no extra screen time, no workflow disruption. A compatible smart pen captures the prescription at the point of care, and AI helps structure that handwritten information into usable digital records. Instead of forcing clinicians to adapt to the system adapts to clinicians. Once that happens, the value multiplies very quickly. The encounter is linked to the patient, the prescription becomes digitally available, the patient can access history, reminders, reports, and follow up information. And approved de identified data can support broader system insight. So, what begins as a handwritten prescription does not end as a fragile paper, it becomes continuity, it becomes usability, and it becomes intelligence for better decisions. This is why Shasthanoti matters at three levels. For patients, it gives continuity and access. For doctors, it gives context without adding burden. And for government, it creates a path towards practical outpatient visibility that can support planning, monitoring, and future policy design. So, this is not just a digital tool, it is a workflow compatible implementation layer that creates value across the care chain. And this is the most important point we want to leave with you today. Shastho Nothi is not a parallel national system. It is a practical layer that can strengthen Bangladesh's existing digital health direction where implementation is hardest. We are not claiming that software alone will solve every healthcare challenge. What we are saying is something narrower, more realistic, and more useful. That a focused pilot can test whether outpatient care in Bangladesh can become more connected, more usable, and more continuous without disrupting doctors. If that is proven, the impact can be meaningful. Thank you.